If you're a healthcare professional wanting to know how to treat spider veins on the legs, you're in the right place. There are 5 essential facts about spider veins on the legs that you, as a doctor or nurse, must know before you make your decision about treating them. I will cover the following. What are they? What do they look like? What causes them? When are they a problem? And how can they be treated? And be sure to stick around to the end when I will tell you the #1 mistake healthcare professionals make when adding leg spider veins to the list of conditions that they treat. And believe you me, it's an expensive one. So what are they? Spider veins on the legs are vessels in the skin up to 1 millimetre in size. They're also known as thread veins or broken veins, and the medical term for these veins is telangiectasia. What do they look like? Spider veins have a typical appearance, and most people instantly recognise them when they see them. They can occur anywhere on the leg, but they're frequently found on the outer thigh, the inner calf, and around the ankle. What causes them? In my practice, 90% of people requesting advice or treatment are women. Young women with no symptoms usually have no serious underlying medical problem. They have no issues with the veins underneath the skin, and in this situation, the spider veins are said to be idiopathic. Women who have symptoms such as leg throbbing and swelling, or leg discomfort around the time of their menstrual cycle, may have a medical cause with the vein valves, a condition called superficial venous reflux, or they might even have varicose veins. In this situation, the spider veins are said to be secondary. Although there may not be anything serious going on, spider veins on the legs always have a feeder vein which needs to be treated as well. And this is important because if the feeder veins are not treated, then treatment to the spider veins themselves will simply be ineffective, or they'll come back straight away. When are spider veins on the legs a problem? For most people, it's the appearance of the spider veins that causes embarrassment, poor self-esteem, and lack of confidence. This is often the motivation for seeking help. For others, it might be symptoms such as leg ache, throbbing, and swelling that are causing concern. A special case to be aware of is the presence of spider veins around the ankle. These ankle spider veins usually indicate a major problem with the function of the veins below the skin. As I say, a condition called superficial venous reflux. And spider veins around the ankle should always be taken seriously. Here's an example of a condition called corona phlebectatica, also known as ankle flares. So in situations where spider veins are associated with symptoms, or if there's an ankle flare, a special ultrasound scan of the legs is required, and it's called a duplex ultrasound scan. And if superficial venous reflux is detected, treatment will prevent complications such as ulcers and phlebitis. How can spider veins be treated? If the appearance bothers your patient, spider veins can be treated by microinjections, also known as microsclerotherapy. If you're a healthcare professional and you want to know more about leg spider veins, download my free guide. The link is in the description box below. Now at the beginning, I said I would tell you the #1 mistake doctors and nurses make when treating leg spider veins. And it's thinking that leg spider veins can be treated by laser, intense pulsed light, or electrocoagulation. In fact, some manufacturing companies actually market these devices to aesthetic doctors and nurses for the treatment of leg spider veins. Well, if you've bought an expensive machine, like a laser machine or an intense pulse light machine, the bad news is that they're not nearly as effective as microsclerotherapy. Expert consensus is that microsclerotherapy is the best treatment for treating leg spider veins. Heat-based treatments such as laser, IPL or electrocoagulation, other treatments also known as thermolysis, shortwave diathermy, are just not as effective on the legs. They're effective on the face, but they're just not as effective on the legs. So please don't make this expensive mistake. Now, if you found this information valuable, please consider hitting the like button. It really does help my channel, and check out all the links in the description box below. Why not leave me a comment or a question? I look forward to reading all of these, and I promise I'll get back to you as soon as I can. I hope to see you again. So don't forget to hit the subscribe button, and that way you won't miss my next video. Thank you for staying to the end, and thank you for watching.